I am a mother, a grandmother, a child psychiatrist, and a wife. Well, I had no intentions of being a psychiatrist when I started medical school. When I got to the psychiatry rotations, luck of the draw, was placed on a child psych rotation. And by day two, I was in love with that. I knew that's what I wanted to do for the rest of my life. Well, my family has never shied away from politics. So, always been involved in organized medicine. I was with AMA for a short period of time. I joined APA and ACAP while I was in training, or right as I finished training. And I have not missed a meeting the whole time. This is going to be like, I don't know, 27 years this time when I go in a row. I have served on committees. I have served on presidential, mm, whatever they call those presidential things that they do. I can't remember, but task force. There we go. Uh,
Okay.
I have done a variety of requested activities. I serve with the SAMHSA Minority Fellowship Committee. I worked with disaster response, membership, diversity and culture, and of course the Native American committees. Um, I love doing the kind of work that they allow me to do. Everything from going up on the hill and begging for help with training and workforce and everything else to talking to local groups, organizing people to make a difference for kids. I was born on the banks of the Singing River, which is the Tennessee, um, on Chickasaw territory. My family had been there as colonizers, regrettably. Um, but as colonizers, they came in and they were friends with the Chickasaw family, the Culberts, who ran the ferry across the river. In fact, George Culbert gave his presidential medal to one of my ancestors, um, yeah, for their help. Um, Later on, I married into a family and I have Cherokee family members and grandchildren.
Yes.
And um, so I've had an involvement at some level from the ground.
You work a lot with Native American children.
I have worked with Native American children all of my career, wherever I have been. I put out the word that I'm willing to be culturally aware
Yes.
and work with whichever tribes or whoever needed that. I've worked with Alaskan Natives, Samoans, Marshall Islanders, so Hawaiians, you name it. I wrote a list and I just stopped. It was well over 130 tribes I had worked with. Currently, I work for the Cherokee Nation. As a child psychiatrist in general, I have multiple ones. Uh,
Okay.
in general, having a child come in and feel like they are worthless. The generational trauma that's been transmitted amongst our Native American families and Indigenous families has been horrible. Um, on a weekly basis, I have family members talk about they have no family traditions or they want to become more traditional, but they don't know how because their family lost that and they name the school that their family member went to. So I see it that way all the time. But to be able to come in and help them understand that it's okay to deal with that trauma, to be good parents and how to be good parents in a traditional way, and then see the children just blossom under that. And some parents blossom as well when they're allowed to grieve. And I have lots of stories about children.
Yes.
If you feel the calling for this, it is the most rewarding, wonderful, heart touching career one can have. I have no regrets about my career choices. I am not burned out like a lot of my friends who went into other areas of medicine, even other areas of psychiatry. I still have lots of energy and I can't wait to go in and take care of my kids. I decided to become a doctor when I was about 12, and I waited till I was 14 to make sure I really knew. And I called my family doctor, my mentor, Dr. Mims, and died a couple of years ago. He was almost 100 years old.
My goodness.
He told me to wait till I was 16 and had a driver's license. And I called him the day I got my driver's license. He said, meet me in surgery tomorrow morning at this place 30 miles away.
Oh my goodness.
I did.
Well,
And out in the summers and on the weekends, had me following him. And he was a true general practitioner. He delivered babies. He did surgery. He provided the psychiatric care because there was no one else. He did it. And he took chickens and eggs and honey in payment. Ooh, old-fashioned,
yes.
wonderful person. But he talked to me. Seriously, he was rounding with me about taking care of the community, that everyone has to be interdependent and has to work together to make that community succeed. Before my training, I graduated from a vocational high school.
Okay.
Classes they had, but they were nowhere up to the city schools. And so it struggled to stay caught up and catch up in some other areas, et cetera. We were poor and didn't know it because everybody was in the same boat. My father was raised in the foothills of Appalachia, and my mother was a sharecropper's daughter who was determined her children would have an education.
Great.
While I was in school, started losing the patriarchs in the family. And I got in med school young, too young, waited for two. So I was in adulting, learning adulting at the same time. Since then, the biggest issue, well, there's several issues. One is managed care. Having people who have high school diplomas or maybe a college degree telling me how to practice medicine. Practicing medicine without a diploma. Questioning my judgment, my choice. The cost of medical care in general, the lack of honoring of the treaties for the tribes, so they've never been funded at the level they were supposed to. The Cherokees were supposed to have a representative in Congress. They've never been seated. That was promised in 1835. You can imagine treaty. Helping people deal with being marginalized. And that's with lots of different communities, BIPOC communities that I've worked with. Watching, the first trans kid I took care of was in like 1985. And it was wonderful how things were progressing. And then suddenly my kids are running scared. Things that have come through the years are horrible. But we deal with them and we help the kids and we do everything we can to help them and we keep fighting. We persevere. Perseverance. My mother was only allowed to go to school one day a week when she was young because she had to take care of the little children. She chose Fridays so she could take the test. When we got into elementary school, my brother and I were in elementary school. She started as a teacher's aide and she started going to college. I rolled her across the stage in her wheelchair because she had a malleolar fracture. Anyway, to get her doctoral hood in my doctoral hood. She went to school the whole time I was going to school. She taught perseverance, practiced perseverance, and she then ran for office. I told you we didn't fear politics. She ran for office. She stood up and sat on committees and has continued to fight for children in our area. So a fantastic role models.
Yes.
And it's just, you don't give up. You dust yourself off and you keep going. So much, but I mean, the best thing is when you have a kid come in and they're depressed or panicky or, down on themselves. And then after a few visits, they bounce in the room. They literally bounce into the room and are talking about the new friends in the or how or they went fishing, and then they're just chatter, but they're happy. I've run the gamut almost. Let's see. I've done private practice. I've taught at a university. I've been the vice chair for a Department of Child Psychiatry. I've helped been the medical officer for a hospital. I've done day treatment for all ages down to a nursery school kind of day treatment where we brought the mother work with them with their infants with bonding. Delivery rooms for mothers who have had trauma and help them bond with babies. I have worked as a liaison and gone on visitations with like ConASH Committee for Native American Children with American Academy of Pediatrics. I've done research with medications. I've done research with suicide prevention programs. I've sat on committees in Washington, D.C. I've done disaster response. I have not worked for the VA, but I veterans. I've seen Iraqi veterans, veterans. I've seen children adopted out of the Eastern European situation, Romania and Russia, that type of thing. I work with foster care. It's a long list. Like I put in a big push for ACAP in general. It has been a second home for me. It has been a professional home. It has nurtured me, opened me up to the idea of a lot of those opportunities that I had, the great imposter syndrome that we all have at one point or another. Going, I know that I should be here, or I don't know that I can do this. But then they brought along and said, yeah, you can do this.